Hello everyone and welcome back to your channel, your path from BDS to DMD. My name is Dr. Jasmine and I'm a practicing dentist in United States. Hope you all are safe, hope you all are healthy and everything is well. Today's topic, we will speak about INBDE and I will walk you through the process and all the information that I have. As a disclaimer, this is information that I have found from my research and I have no affiliation with anyone. This is your path from BDS to DMD, and let's go through the slides. Okay, so National Board Part 1 is supposed to be discontinued by July 31st, 2020 of this year. The INBDE will be available for administration beginning August 1, 2020. At least these are the dates that we have as of now. They may be subject to change, so please make sure that you follow the ADA website. I will put all the links in the description. July 31st, 2020 is when the National Board Part 2 will be discontinued. So this is 2020. We have 2 more years for the Part 2 to be discontinued. I will, through the entire presentation, at one point, I will walk you through a few sample questions and some more details about the INBDE. Due to copyright issues, I will not be copy pasting those slides even with credits because that's the way ADA has it on their website. But I will share the links of those PDFs. They are available to everyone. They are on the ADA website, but I'll make it easier for you so you don't have to hunt them. So what is INBDE? INBDE is one combined exam and it will test your patient care, your approach of practicing dentistry, and your knowledge of advances in dentistry. So instead of Part 1 and Part 2, there will be one exam which will have questions and which will be more comprehensive. The number of questions. So this is a link that I've given you, and like I said, I will share it in the description box also. So National Board Part 1 and Part 2 combined had 900 questions, whereas the new INBDE will have 500 questions and you have about 1.5 days to complete. Now, there are no details about how this 1.5 days will be, but as soon as we find more details, I'll be happy to share them with you. So one good news is that you don't have to worry about 400 questions because it's just 500 and not 900 anymore. Plus, it's combined together. Let's talk about a few scenarios and few situations because this is something which is very important. So if you've already taken your Part 1, should you take Part 2 or should you take INBDE? So if you're a current dental student and still in school and have taken Part 1, you can attempt Part 2 until July 31st, 2020. If you're an international trained dentist, you can take Part 1 and Part 2 as long as it's before July 31st, 2020. You can consider INBDE, but the Part 1 will not be counted towards INBDE. So even if you have taken Part 1, you've passed it, and then you decide to take INBDE, the Part 1 will not be counted. So the good idea until Part 2 is discontinued is to take Part 2. If you fail INBDE, even if you attempt it once, you cannot retake Part 2. So basically, once you switch to INBDE, that is your only option. Coming to the eligibility of INBDE, it will be same as NBDE. So that does not change. The eligibility factors are still going to be same. Whether you are a dental student in US or you are an internationally trained dentist, the eligibility criteria will still remain the same. Next, go to the next slide. Okay, what does this say? So what is the INBDE transition time? If you've completed Part 1 and Part 2, you don't have to take INBDE. If you've not completed Part 1 or Part 2, you may choose to take INBDE. So if you've not attempted either, you can take INBDE, but just remember, once you take INBDE, you cannot go back to the Part 1 and Part 2. If you failed Part 1 or Part 2 before its discontinuation, you have to complete INBDE. Attempts for NBDE, sorry for the typo, I meant INBDE. they are independent. And basically 5 years, 5 attempts for NBDE are separate, and 5 years, 5 attempts for INBDE are separate, which is actually a good thing. But here's the catch. When reporting results to the school, all your attempts will be reported. So that will be part 1, part 2, INBDE. So INBDE is not a way of not reporting all scores to your school. So those will still be reported. INBDE retest policy. You have 90 days wait between exams, and after the 30 days, after third attempt, you'll have to wait 1 year for retest. This policy will be reviewed again in 2021 by the Joint Commission of National, Dental Board Examinations. But for now, the policy is exactly the same as for part 1 and part 2. So if you fail an exam, you wait for 90 days. If you fail, for third attempt, you have to wait 1 year for the retest. This is from the ADA website, what I just said, 5 years, 5 attempts eligibility rule. So 5 years of your first attempt or 5 examination attempts, whichever comes first. So I think this hasn't changed. So let's talk about some scenarios, and I'm going to go really slow, give you, I want to say at least 8 or 10 different scenarios. So if you pass part 1, part 2, you do not have to attempt INBDE. Yay! If you pass part 1, but you've not attempted part 2, then you are eligible for 5 attempts on part 2 before the cutoff date, but you're also eligible for INBDE. But remember, if you take INBDE, then your part 1 is not counted towards it. If you've passed part 1, and then you have 5 attempts of failed pass 2, then this may be a good news that you are eligible for 5 attempts of INBDE. So although you've exhausted your attempts for National Board Part 2, INBDE may be a boon for you, that you can take it all over again. And 5 years, 5 attempts criteria starts all over again. If you fail part 1 5 times, then you're not eligible for part 2 and you can take INBDE. So, that is also a boon for people who have been struggling to pass part 1. If you've taken 4 attempts for part 1 and you passed the 5th time, but you fail part 2 5 times, so you're not eligible for part 2, but you are eligible for INBDE. If you pass part 1 and if you take INBDE, but if you fail INBDE in the first attempt, then you cannot go back to National Board Part 2. You have 4 more attempts of INBDE. If you pass Part 1 and if you fail 5 times the new INBDE, then you have exhausted all your attempts for the exam. If you pass INBDE once, then you don't have to retake. If you fail INBDE 5 times, then you have exhausted all your attempts again. If you've passed part 1, but you failed 4 attempts of part 2, and you're very close to the date of part 2 before its discontinuation, then you are eligible for INBDE. So basically, it's very simple. If you switch to INBDE, you can no more go back to part 1 and part 2. But to take part 2, you at least have until 2022. So I hope these scenarios help, and I'll try to put a PDF link because this is also on the ADA website. Scoring, we've already said it's going to be a pass score or a fail score. So the good thing is if you pass, they just report pass on your transcript that you get. If you fail, they'll let you know the score. I think right now they are working on how to help candidates who fail the exam in understanding where they fail, what are the questions that they should have attempted differently, or but I think they're working on it. So I don't have a concrete answer on any of the ADA websites about the failing scoring and how they are going to report it to the candidates. But with pass, you will not have a score. So what questions to expect on INBDE? And I'm so thankful that ADA actually has this PDF, which is on their website, and I'm sharing a link in the description. Like I said, previously that I unfortunately cannot have screenshots even if I give credit to ADA because of the copyright reasons, and although I've requested um, for a permission, but because of the current situation, a lot of offices are not open. But on those questions, they have a scenario and then there are answers on the right side. So I'm going to tell you how to understand the key of the PDF. So on the key, the first one will be they give you the answer. The second has something which says F as in Frank and K as in kite. Now this means foundation of knowledge areas. And as we progress through our video, I'll tell you what it means. And the third one you'll see is CC, which means clinical content areas. And that also I'll tell you what exactly it means. So let's go to the clinical content area. And I'm going to open it on another screen, so when I talk to you I can see it clearly. So clinical content area, it comes under the domain of dentistry. So basically clinical content, there are 10 foundation knowledge areas, and in the clinical content area there are at least 56 different clinical content areas that you will be expected to answer questions on. So this is the link to the PDF. Go ahead and you can see it. But 36% of your questions on the exam will come from diagnosis and treatment planning. 42% will come from oral health management, and 28% will come out from practice and profession. So when you say diagnosis and treatment planning, so what the document says is it has 15 different points under diagnosis and treatment planning, which includes identifying the chief complaint and understanding the contributing factors, using clinical and epidemiological data to diagnose and establish a prognosis for dental abnormalities and pathology, to formulate a comprehensive diagnosis and treatment plan for patient management, to understand how patient attributes, which means their gender, their age, their race, their ethnicity, their needs, social backgrounds, and how all of these affect the oral health care at all stages, and the interaction and communication with patients using psychological, social, and behavioral principles. So please expect at least 36.2% questions from these 15 clinical content area. The second one is oral health management. So what this will include is prevention and recognition of medical emergencies, how you recognize them, how you treat them, then prevent and recognize and manage dental emergencies, prevent, diagnose and manage pain during treatment, diagnose and manage caries, pulpal and periradicular diseases, perform oral surgical procedures. So oral health management is basically going to quiz you a lot on hardcore clinical problems and day-to-day problems that, and issues and situations that you will face. And this will constitute almost 42% of your questions. The good thing in this is that as clinicians, we all have read and practiced so much in this that I am hoping these 42% of questions will be easier for you to solve. Then the third part of the clinical content is practice and profession. So what comes in practice and profession? Evaluate and integrate emerging trends in healthcare, conduct practice activities in a manner that manage risk and is consistent with jurisprudence and ethical requirements in dentistry and healthcare. It talks about OSHA and HIPAA, which is occupational safety and Health Information Portability and Accountability Act. So which means, if you're going to transmit a patient data, what are you going to do about it? What are the precautions that you will take? How will you protect the patient data? And OSHA is all about how will you protect yourself, how you'll protect your staff, what are the things that you will consider, and what are the recommendations that OSHA has that you will follow to ensure the security and safety of you and your team members. And communicate case design to lab technicians and evaluate the resultant restoration of prosthesis. So this 21% is more inclined towards your practice and your profession. So I want to say that on the document there are about 56 different points that are under these three clinical content areas. let's go to the foundation knowledge and what it means. And we are still talking about the key on the right side of the PDF and the questions that you will be quizzed on. Okay, let's talk about foundation knowledge. So foundation knowledge has 10 different segments, and it says that a successful entry-level general practitioner is focused on prevention, management, diagnosis of oral diseases, and the promotion and maintenance of general health. So under these 10 different foundation of knowledge, it has the first one is molecular, biochemical, cellular, and systems level development, structure, and function. The second is physics and chemistry to explain normal biology and pathobiology. The eighth one is about pharmacology. I'm not going to go through all 10 of those. This is the link. It has all the details and I'm literally reading from it. So, I would rather have you invest time in reading those foundation knowledge. So basically between the foundation knowledge and the 56 different clinical criteria that we spoke in the last slide. So the clinical content area and the foundation knowledge, that's how your questions are going to be structured. So if I look at the foundation knowledge, and there's a beautiful graph that is on this PDF that you will see, which says, let's say, for example, pharmacology. So 10% of your questions will be on pharmacology. To be specific, 10.6%. Research methodology and analysis and informatics tool, you'll have, that's your foundation knowledge 10, and it has about 9.8% questions. So if you go to this PDF about domain of dentistry, so it has 10 foundation knowledge listed. It has the clinical components, which are 3 of those: diagnosis and treatment planning, oral health management, and practice and profession. Between these, it gives you an exact breakdown of how the questions will be structured. Let's go over a few questions that are on the PDF that I have, and I feel the INBDE has more direct questions, and I feel it is. I believe it's going to be easier for all of you to study and crack this exam. So let's say they have about 43 questions and it's a 44-page document. The question says occupational safety and health administration bloodborne pathogen standard requires healthcare employers to do each of the following except, and what is the exception? So it says establish an exposure control plan, implement the use of standard precautions, make hepatitis C vaccinations available, and provide personal protective equipment. So which of these 4 is not mandatory for a dentist practice or for an employer to have for the employees? So the answer is pretty straight. Of course, it's hepatitis C. We are required to have people sign a hepatitis B consent form, and if not, provide them with the tools to get that vaccination, but not for hepatitis C. And then if I look at one of the clinical questions, and I'm just going to go through one of those because it's, you can go through the remaining 43 of them. So they say there is a male, 48 years old, who says, I've been in pain for 2 days and now my face is swollen. The patient has hypertension, type 2 diabetes, penicillin allergy. And the current findings are facial edema, lymphadenopathy, extensive apical radiolucency associated with tooth number 6. 100 degrees temperature, blood pressure is 150 by 93, and a blood glucose level of 240. So the question is, where is the infection most likely located? So it's tooth number 6. So tooth number 6 is canine. And the 4 options are buccal vestibule, canine space, nasal cavity, and pterygomaxillary space. So if you look at the question, it's pretty simple. Facial edema, apical radiolucency with number 6. So the answer is canine space. So I feel it's more direct questions, something that all of you can quickly relate to if you read it carefully. So I think in the last few slides we spoke about how to read the key. What does FK means, foundation knowledge? What does CC mean, which means the clinical component section? And please go through these PDFs. They are very helpful. They will give you an idea of what to expect on the test. Specifications of the exam. So on this particular document, which says specification of the exam, they have broken down exactly what I said before, and it's a document from 2018. I did not see a newer document, but please go through this document. It will give you a few more details. History of the exam. Now this document, I really would want you to at least go through it once. It is about a 61-page document, and things have changed because this is from April 2016. This document tells you about the field of testing, the implementation plan, why did they start the INBDE, who were the people involved in that, what are the different domains. I think you'll see a slight difference that in this document they talk about 65 clinical content area, but again this is a 2016 document, and the most recent one is 2018, and that has 56 clinical components. So you will see that difference. And on this document it says there are going to be 450 questions, but on the newer document it says 500 questions. So I feel I will go with the newer documents, but this particular 61-page document will give you a bigger picture and a better idea. So for example, let's say if we look at the foundation knowledge 7, which was about biology of microorganisms in physiology and pathology. So in the past, this particular section on the part 1, they would talk about immunopathology, microbiology, mycology, pulp biology, oral biology, parasitology, and they would talk about viruses. On part 2, a question about pharmacology would come. I think in the newer one, they have added epidemiology, preventive medicine, and public health. So if you look at the slide, this is it's slide number 18 on this particular document. It tells you in green, it has the questions that were on part 1. In yellow, it's the questions that were included in part 2. And in orange, they are the newer questions that are being added. I really like this document. It tells you the different types of questions and the different foundational knowledge areas that you will be judged on. If you have any questions, any concerns, please let me know. I know INBDE is a new exam. There will be a lot of questions due to the current situation outside. At least as of now, the dates that I gave at the beginning of the slides, they may still remain the same, but if there are any changes, I will definitely post them, and I will pin that post on the top. But for now, those are the cutoff dates for the exam. I believe that you should prepare for these exams exactly the way you were preparing for part 1 and part 2. Make sure your clinical knowledge is strong. INBDE, they expect it to administer it very soon, but for sure the part 1 will be discontinued July 31st, 2020. Part 2 will be discontinued August 1, 2022, and at least from a document that is published and it was updated July 2019, it seems that the INBDE administration will begin August 1, 2020, which is a few months from now. But if things change, the ADA is very prompt about responding to questions or publishing, on their website. But if you have any questions and if you would like me to contact any of these organizations on behalf of you, I will be more than happy. Please feel free to send me questions. Study hard, study smart. Make sure when you read the questions, never be in a rush to answer them. And you know what? I realized this after not with my national boards part 1 and part 2, but when I was preparing for my TOEFL and GRE, I would read the options first and then I would read the question, because especially with GRE, when you're studying for your English and math, there were way many questions to answer, and I think if you are stuck in one question, and sometimes as physicians, we are we are trained to solve problems, so we tend to stop at that question, and that takes a lot of time. But get in a habit of going to the next question and then flag the questions which you feel you're not very confident about, and then come back to those questions. But don't invest a lot of time in one question, because you want to get through this exam. And like always, feel free to share, comment, like, subscribe. Please ask me as many questions as you have, and I will be more than happy to answer them. So let's see what we have in our next video. So our next video, we will talk about CAPID applications stepwise. One of the reasons I want to walk you through stepwise CAPID applications is because once you start filling the application, there are certain questions where you are unsure about what to write, what to check, how by checking this particular box it is going to affect your application. I did speak about how to prepare for CAPID, and I strongly feel that you should start preparing for CAPID as soon as you know that you want to come to the United States and study dentistry. So there is no timeline or time frame. But to prepare for your actual CAPID application and to fill the application online, please do not wait for the next application cycle to start. You can always create a user ID password. You can start filling in the application, and then whenever the application cycle starts, that's when you can select schools and colleges. But don't wait until the last minute to start your application process. Stay healthy, stay safe, stay positive, stay blessed, and we will talk very soon. Take care. Bye for now.